The big component to testicular cancer is, although it's not hormonally linked, we are removing the organ that is the number one place where we're expected to make testosterone from men. It is a very important part to no longer have testosterone in the same levels. Hi there, my name is Dr. Katrina Cox. I'm the author of The Opportunity in Cancer and the founder of the Cancer Remission Mission. Welcome to our video about testicular cancer. In this video, I'm going to address three major questions. The first one, what supports during maintenance therapy are valuable for testicular cancer survivors? Number two, frequently patients with previous testicular diagnoses are looking for prevention and how to reduce their risk of reoccurrence. And three, how do we address lingering symptoms and regain body confidence? What supports during maintenance therapy are valuable for a testicular cancer survivor? Generally, maintenance therapy is not something that happens a lot in testicular cancer. And the reason is, although this is a reproductive cancer, it's not hormonally linked for most of the cases. What that means is that there are no interventions that we can do from a conventional perspective or medications to stop reoccurrence from happening. And so those maintenance therapies are not the same for, say, prostate or breast cancer. However, because this cancer happens in younger men, 18 to 35, there are some blood tests that we can monitor in order to be able to make sure that there isn't a cancer regrowth. Sometimes if a patient has not received chemotherapy in the past, or even if they have, and those numbers start to climb, they will go back into treatment and use chemotherapy as part of their maintenance plan. What are some of the strategies that testicular cancer survivors can use to prevent reoccurrence? The first thing and way to address this is to understand what we use conventionally in order to monitor tumor regrowth. And those are three tests. One called AFP, alpha fetoprotein. Two, beta HCG, human chorionic gonadotrophin. And three, LDH, lactate dehydrogenase. Not a single one of those tests by themselves is very important, but put in combination with each other, they can be indicators of tumor growth and or regrowth. And so that's really important. Knowing those, we can look deeper into what could be helpful for preventing reoccurrence. The first thing that I look at is our vitamin D levels in our blood. So doing the vitamin D 25OH test is very important because there are some cancer studies that have shown that those that have been diagnosed and go through treatment are 80% of those people are frankly deficient in vitamin D. And so that means they have really low levels of vitamin D. We've also seen studies show that if we keep our vitamin D level in the top quarter of the range, so that's between 200 and 250, that we can reduce reoccurrence by up to 50%. And so that's huge. Knowing that level can help us as one part of our prevention reoccurrence strategy. The second level that we can look at is our cortisol levels. Stress is a big indicator of cancer regrowth. And for those between the ages of 18 and 35, going through a cancer diagnosis and treatment can be massively stressful on the system. So understanding that although there's not a connection between testosterone and the cancer development, there is now a connection with the fact that we've removed the organ that is primarily responsible for making testosterone in the body. We also know from a physiology perspective that the adrenal glands will then start to try to make testosterone to fill in the gaps. And so understanding what our cortisol levels and how our stress is impacting our adrenal glands is very, very important. The third one that I like to look at is inflammatory markers. So looking at the inside of the body, how is the body and the matrix of the immune system and all the other parts working together? So inflammatory markers such as C-reactive protein and ESR, erythrocyte sedimentation rate, these two have been shown in studies to reduce the risk of reoccurrence if we keep them really, really tightly regulated. So CRP should be less than 1 and ESR should be less than 10. And so knowing what those can also help with lingering symptoms, which we'll talk about in the next question. The last one that's very specific to testicular cancer is vitamin B12. And this is interesting, especially for those that have previously used chemotherapy as a part of their treatment strategy towards their testicular cancer, because B12 is connected with compromise of the immune system and the nervous system. And these two places need to be addressed and recovered post-treatment. And so it can help us, if we keep our B12 in the right range, to reduce our risk of reoccurrence. What are some of the ways that testicular cancer survivors can restore their body confidence and address any lingering symptoms that they may have? The big component to testicular cancer is, although it's not hormonally linked, we are removing the organ that is the number one place where we're expected to make testosterone for men. And so because you're between the ages of 18 and 35, which is the prime category for those men that are going through testicular cancer, it is a very important part to no longer have testosterone in the same levels. And lingering symptoms can really include a large perspective of this. Mental health can be affected. So depression and anxiety can become part of the problem. Sleep deprivation can be part of this. Fatigue, which will then be because of sleep, and muscle weakness and wasting. And then, of course, lack of libido. And the last one that can really connect the dots is fertility. And so these big lingering concerns or symptoms can look in a variety of ways for different people, but understanding that they all run down to testosterone and there are ways for us to address it are very, very important. The first way is to address our vitamin D level. One of the other parts of the video, we talked about making sure we know where we're at, but understanding its relationship and how it's related to those cortisol levels and testosterone levels is very important. So addressing and keeping that up, that level up, the vitamin D level up, is very important. The second deficiency that can have a role to play in this is zinc. Zinc is one of the building blocks for testosterone as well as your immune system. And so understanding that zinc is a key nutrient for the men that are suffering as testicular cancer survivors is very important. And addressing it is pretty easy to do. The third thing that we like to do is exercise. If you're a testicular cancer survivor, understanding that the sweet spot for bringing in exercise that includes high intensity interval training or resistance training is in the first 24 months after treatment. So within those first 24 months after treatment and or diagnosis, if you can engage in well put together HIIT programs, high intensity interval training or resistance work, it can have a huge impact on your fatigue and that muscular wasting. It will also help reverse some of that lack of testosterone and kick in the alternative systems that can be supportive of that. The last thing to support testosterone and the male body after testicular cancer is herbal interventions. There are things such as saffron and ashwagandha that have been studied in this population in post-cancer, and they can help really address some of those symptoms and balance the nervous system as well as the mood changes and fatigue levels. And so talking to a naturopathic doctor or somebody who knows about those herbs and how they might be relevant for you is a very important thing.